I'd like to just cover what I call the 7 myths of single-payer health insurance. Okay, many of you have heard about these from town hall meetings or things that you might have read or heard. The first myth, what I call the alpha myth, is that it's socialized, government-controlled health care. Now, that is simply not true by definition. Socialized medicine means this: you get universal care, publicly financed, but you're constrained to go to a government-employed physician and be treated at a government-owned hospital. So your choices are limited. Okay, examples of socialized medicine is the British National Health Service and the American VA health system. Single payer, on the other hand, is universal care, publicly financed, but you go to a private doctor and you're treated at a private hospital. A physician and a hospital that you choose, not your employer, not your insurance company, and certainly not the U.S. government. And the analogy I like to use is the interstate federal highway system. Okay? The government doesn't build the roads. They don't pour the concrete out there on 496. They don't build the bridges. They go out and they hire private contractors to do that. And when you drive, you don't have to get permission from the government when you can drive and when you can't, what entrance to get on, what exit to get off. You don't have to call anybody to take more than 2 passengers. You don't have to fill out a form to tow your boat or your trailer. And everybody, regardless of whether or not you drive a motorcycle, a motorhome, a car, a truck, you get on the road, and you cross from state to state, you're in the same direction, you're going on the same road. That is a model of something that the government does reasonably well. And the model for single payer is the Medicare program, which is a universal, portable, affordable, comprehensible, administratively lean, automatic enrollment, single-payer program. The administrative costs for Medicare are about 3% versus 16, 18, 20% or more for private health insurance. It has a high rate of approval among seniors, between 60 and 80%. There's no private insurance plan that I know that comes even close to that degree of approval. And if you ask seniors, they'll tell you that, in general, Medicare, along with Social Security, are the 2 best things the government ever did for them. Single payer is supported by, depending on what polls you read, anywhere between 60 and 70% of the American public, by 59% of American physicians. It's supported by multiple medical organizations, more than 500 labor unions, 3 Nobel Prize winners, and 88 members of Congress. Second myth is Canada. Oh my gosh, we don't want what they have in Canada. All those problems, people dying in the streets, long waits to get care. The first and most important thing you got to remember about Canada is that they only spend about half of what we spend on healthcare on a per capita basis. So the Canadian healthcare system is grossly underfunded by American standards. I have no doubt that if you took a Canadian-style system and you funded it to the tune of $2.5 trillion, which is what we'll spend this year, I don't think you're going to have 9-month waits for MRIs. So the problem in Canada is not the system, it's the money. The problem in America is not the money, it's the system. If things are so bad in Canada, why is it Canadians live longer than we do despite comparable rates of smoking, alcoholism, and older age? If things are so bad in Canada, why is it that a baby born today in Toronto has a better chance of seeing her first birthday than a baby born in Detroit? If things are so bad in Canada, why is it Canadian systems are more likely to have a regular physician, less likely to skip a recommended test or procedure, less likely to not get a prescription drug filled at the pharmacy? If things are so bad in Canada, why are the outcomes generally as good and for some conditions actually better than they are in the United States? You've all heard these stories about thousands of Canadians flooding over the borders every day to get health care in the United States, right? In fact, the standard joke is the 3 best things about Canadian health care are Buffalo, Detroit, and Seattle. There is no evidence that large numbers of people from Canada are coming over to get health care. I've worked for 21 years in emergency departments at 2 very large medical centers in southeast Michigan, less than 40 miles from the Ambassador Bridge. I've seen 4 Canadians, right? And one of them, I'll never forget him, he was in a car accident. He had no choice. What do you think the first words were out of his mouth? Send me to Windsor. There is no evidence that Canadian doctors are migrating to the United States. In fact, for the last several years, Canada has actually had a net gain in their physicians. They went somewhere else, tried it, didn't like it, and moved back. And then what about all those weights you hear? 83% of Canadians get elective surgeries within 3 months. Okay? If you want to talk about weights, which country do you think has the longest wait in the world? Okay? What about the United States with over 40 million individuals in this country waiting to get basic health care? There is no evidence that there's a wait list for emergencies in Canada. None. Zero, nada. They're not dying on the streets in Toronto because they've had a heart attack and because they can't get care. And finally, every country in the world rations health care, okay, to some degree or another. Canada rations by medical need and urgency. We ration by ability to pay. What do you think is more egregious? The third myth is medical innovation. If we destroy the private enterprise system we have now that feeds our private insurance companies, if we replace it with a single payer, then all these things that you've come to know, there's going to be nothing in the pipeline coming up. There's absolutely no evidence of what I'm aware of, that the country's propensity for medical innovation is predicated on the way they finance their health care. None. Can anybody here name me a blockbuster drug that was developed by Blue Cross Blue Shield? How about a life-saving procedure that came to us from United Healthcare? All right, anybody name me that stuff? If you want to talk about technology, if you look at CAT scans, MRIs, diagnostic ultrasound, laparoscopic cholecystectomies, coronary angioplasty, heart transplants, treatment for peptic ulcer disease, all came from single-payer countries. Okay, some of the things that you know and you hear about every day came from other countries. Who do you think funds the lion's share of medical research in the United States? You ever heard the National Institutes of Health? $30 billion they'll spend this year just on medical research. Okay. The fourth myth is overutilization. Okay? If we get a single payer plan, then everybody will be rushing to my ER and getting care. Well, the model for that is Taiwan. Okay? In 1994, when Taiwan passed its National Health Insurance Act, 57% of the Taiwanese had health insurance, only 57%. 3 years later, that rate was up to 97% with their single-payer national health insurance plan. There was no statistically significant increase in the rate of emergency room utilization between 94 and 97. If you look at the rate of emergency room utilization in Canada compared to the United States, it's roughly the same, about 39 visits per 100 population. If you look what happened in Massachusetts when they passed their universal health care law in 2007, there has not been an increase in ER utilization in that state either. The next myth, the fifth myth is, well, why don't we just let the market work? Okay, that's the problem. You know, the market isn't working, there's too much government regulation, it's interfering. Well, I would suggest to you that the market has not worked so far. The business model of private insurance is not working. You talk about insurance companies that want to preserve choice. Okay, what I believe Americans want is not a choice of health plan, but a choice of doctor and a choice of hospital. I don't think that the average American really cares who the middleman is, as long as they can go to the doctor of their choice and go to the hospital of their choice. What exactly has the market done for us in the last 20 years? Well, increase in the number of uninsured, a decrease in the choice of provider, diversion of resources to more profitable ventures, consolidations of HMOs and PPOs into managed care oligopolies, underfunding of less profitable ventures such as public health, mental health, and trauma care, unaffordable prescription drugs, dissatisfied patients, frustrated physicians, and an unsustainable trajectory of healthcare costs. That's what the market has brought you in the last 20, 30 years. If they could have fixed the problem, they would have, and they should have, but they're not interested in doing that. The sixth myth is that it's not politically feasible. Well, I would suggest to you that it's conventional politics that got us into the mess that we're in right now. And we should be careful to distinguish between what's desirable and what is doable. If we only had to worry about what was doable politically, we never would have gotten women's suffrage, we never would have gotten the Civil Rights Act of 1964. And perhaps Rosa Parks should have just given up her seat on the bus. We never would have made any progress in those areas. That's what they said about Medicare back in 1964. It's politically impossible. It'll never get passed, and yet it did. Canada, before it got its National Health Act, had a private system like ours. In fact, Blue Cross Blue Shield had a presence there. They managed to get around that and create a single-payer program. And finally, the last myth is that, well, we can't afford it. Well, I would suggest to you that we can't afford not to. The healthcare costs are going up, as you all know. You sit down every month to write the check for the health insurance premium. You're noticing that it's gotten a lot worse lately. Estimates of how much we spend in administrative waste in this country vary anywhere between $250 and $400 billion a year. We spend about $1,000 more per capita than the Canadians do just on healthcare administration alone. Last year, $96 billion went to insurance companies. I don't believe that it is politically impossible to do this as long as we keep our nose to the wheel and do what we know, what we think is right.